CNA test questions. Question 1. If a resident starts to fall while walking, the CNA should try to catch the resident and hold them upright. Step out of the way to avoid injury. Guide the resident to the floor using the gait belt, protect their head, and call for help. Grab the resident's arms to prevent the fall. If a resident starts to fall, do not try to catch them, this can injure both of you. Instead, use the gait belt to ease them safely to the floor, protecting their head from impact. After they are on the floor, call for help and do not move them until the nurse arrives. Question 2. The CNA is caring for a resident who is on oxygen. The CNA finds the resident with his oxygen tank smoking in his restroom. What should the CNA do immediately? Remove the cigarette from the resident's hand. Turn off the oxygen. Remove the resident from the room and then turn off the oxygen. Call the fire department first. Oxygen is highly flammable. The immediate priority is to remove the resident from the presence of the ignition source, the lit cigarette, and oxygen. Then turn off the oxygen and follow facility fire safety protocol. Safety of the resident comes first. Question 3. Your resident is able to assist with transfers. What is the correct body mechanics technique for helping the resident stand? Place the gait belt around the resident's chest, keep your back straight, and pull upwards. Position yourself close to the resident, keep your back straight, bend at the hips and knees, and lift with your legs. Lean back while pulling the resident up. Position yourself 2 feet away, grab the gait belt, and pull the resident toward you. Proper body mechanics for a transfer require you to position yourself close to the resident, maintain a straight back, bend at your hips and knees, and lift with the strong muscles of your legs and thighs. This protects your back from injury. Question 4. You have a resident who ate chili for lunch and is now complaining of chest pain. What is your first step? Give the resident an antacid. Call 911 immediately. Report the chest pain to the nurse immediately. Tell the resident to lie down and rest for 30 minutes. Chest pain can be a sign of a heart attack and should never be assumed to be indigestion. Report the complaint to the nurse immediately for assessment. The nurse will determine if emergency services need to be called. Question 5. Your resident is lying down napping when she suddenly begins to vomit. What is your initial intervention? Clean up the vomit first. Call the nurse immediately. Turn the resident's head to the side to prevent aspiration. Put a basin under the resident's mouth. Your first priority is to protect the resident's airway. Turning the head to the side allows vomit to drain out of the mouth rather than being aspirated into the lungs. After securing the airway, you can then get a basin, call for help, and clean up. Question 6. Your resident keeps her room very cluttered. For her safety and the safety of the staff, what should you do? Report the clutter to the nurse as a fall hazard. Clean the room yourself when the resident is at therapy. Ask the resident's family to come in and clean. Ignore it, as it is the resident's right to keep her room how she wants. Clutter creates fall hazards for both the resident and staff. Report the situation to the nurse, who can work with the resident and family to find a solution that respects the resident's rights while ensuring safety. Never throw away a resident's belongings. Question 7. As people age, they may lose some ability to feel heat or cold. This change increases the risk of which problem? Burns from hot water or heating pads. Dehydration. Hypothermia only. Sunburn. Loss of temperature sensitivity in the elderly means they may not feel when water is too hot or when a heating pad is causing burns. Always test water temperature on your own wrist before providing a bath or wash. Keep heating pads on low settings and use protective covers. Question 8. A CNA is preparing to take residents to the dining room for lunch. The CNA notices that the floor is wet from a spill. What should the CNA do first? Take residents around the wet area. Clean up the spill immediately before bringing residents through the area. Wait for housekeeping to clean it. Put a towel over the spill and proceed. Wet floors are a major fall hazard. The CNA must ensure the path is safe before moving residents. Clean the spill yourself or call housekeeping and wait until the area is dry before walking residents through. Question 9. A resident is ordered to wear an ankle-foot orthosis (AFO) on the right foot. When applying the AFO, the CNA should put the AFO on over the resident's shoe. Place the AFO in the shoe and have the resident put their foot in. Apply the AFO directly to the bare foot, then put the shoe on. Apply the AFO over a well-fitted sock, then put the shoe on. An AFO should be applied over a well-fitted sock to prevent skin breakdown. The AFO is worn inside the shoe. Never apply the device directly to bare skin, as friction can cause pressure sores. Question 10. While receiving personal care in bed, a resident begins to have a seizure. The nurse aide should hold the resident down to reduce injury. Keep the airway open and protect the resident from injury. Put a spoon in the resident's mouth to prevent tongue biting. Leave the room to get help immediately. During a seizure, do not hold the resident down or put anything in their mouth. Protect the resident from injury by moving furniture away, loosen tight clothing, and turn the head to the side if possible. Time the seizure and report it to the nurse. Question 11. When should you wash your hands? When you notice they look or feel dirty. When the head nurse tells you to. At least twice a day. Before and after contact with a patient. You should wash your hands before and after contact with a patient. Hand hygiene is also required before and after wearing gloves, after contact with body fluids, after touching the environment, and before performing any aseptic procedure. Question 12. What is the single most important way to prevent the spread of infection in a healthcare setting? Wearing a face mask at all times. Proper hand washing. Using antibiotics correctly. Isolating all patients. Proper hand washing is the single most effective way to prevent the spread of infection. Hand hygiene should be performed before and after patient contact, after removing gloves, and after contact with any body fluids. Question 13. Standard precautions require healthcare workers to treat all bodily fluids, non-intact skin, and mucous membranes as if they were sterile and harmless, infectious, clean and safe, non-infectious unless tested. Standard precautions require that all bodily fluids, non-intact skin, and mucous membranes be treated as if they are potentially infectious. This universal approach protects both the healthcare worker and the patient from unknown infections. Question 14. When washing hands, the CDC recommends scrubbing for at least 5 seconds, 10 seconds, 20 seconds, 60 seconds. The CDC recommends scrubbing hands for at least 20 seconds with soap and water. Washing for this duration ensures removal of most transient microorganisms. Singing "Happy Birthday" twice helps estimate the appropriate time. Question 15. When removing contaminated gloves, a CNA should pull them off by the fingers. Grasp the outside of one glove near the wrist and peel it off, Then slide fingers under the remaining glove and peel it off from the inside. Remove them by biting the fingertips. Shake them off into the trash. Removing contaminated gloves correctly is critical to avoid transferring microorganisms to your bare hands. Grasp the outside of one glove at the palm or wrist, peel it off, and hold it in the gloved hand. Then slide ungloved fingers under the cuff of the remaining glove and peel it off inside out. Question 16. Identify the type of items that must be disposed of in a sharps container after use in patient care. Disposable gloves and gowns. Needles, syringes, and lancets. Used bandages and gauze pads. Empty medication vials. Sharps containers are specifically for sharp medical instruments, including needles, syringes, lancets, and any device that can puncture the skin. Improper disposal of sharps is a serious safety hazard. Never recap needles. Question 17. When removing personal protective equipment, PPE, the first item to remove is face mask, goggles or face shield, gloves, gown. Gloves are considered the most contaminated piece of PPE and should be removed first. After removing gloves, perform hand hygiene before removing other PPE, goggles or face shield, then gown, then mask. This sequence prevents contamination of the face and clothing. Question 18. A resident has Clostridium difficile, C. diff. What type of precautions should the CNA use? Standard precautions only. Droplet precautions. Contact precautions. Airborne precautions. C. diff requires contact precautions because it is spread by direct contact with the patient or contaminated surfaces. Alcohol-based hand sanitizers are not effective against C. diff spores. Hands must be washed with soap and water after patient contact. Question 19. Which of the following is the best way to prevent the spreading of germs in a healthcare facility? Wearing gloves during patient care. Wearing a mask and gloves with patient care. Thorough hand washing between each patient contact. Wearing a gown and gloves during all care. While gloves, masks, and gowns are important for certain situations, thorough hand washing between each patient contact is the single most effective method for preventing the spread of germs. Hand hygiene interrupts the chain of infection at the most critical point. Question 20. When putting on PPE, the CNA's first step should be to put on the gloves, put on the gown, perform hand hygiene, put on the mask. Hand hygiene must be performed before donning any PPE. A logical sequence is hand hygiene, gown, mask/goggles, gloves. Proper donning and doffing of PPE protects both the healthcare worker and the patient.